Great. Well, good afternoon and welcome everyone. My name is Cassie Kiefer, and I'm a recruiter with the County of Santa Clara's Employee Services Agency. We're very excited to host our latest information session featuring career opportunities today for medical assistants in the County of Santa Clara's Custody Health Services Department. Custody Health is the department that provides medical and behavioral health services in our county's correctional facilities. And we're excited to have you here to learn more about this unique department. So before we begin, I just have a couple of quick housekeeping items to share. This event is being recorded and streamed live on Zoom, as well as LinkedIn, Facebook, and YouTube. We'll also be posting the video recording on all of these platforms after the event if you want to rewatch this anytime. If you are joining us live, thank you for tuning in. Feel free to drop your questions into the Q&A section of the Zoom menu. We have an amazing team of recruiters working behind the scenes to answer your questions in real time. So don't be shy, ask us anything. One note for viewers who are watching from LinkedIn, Facebook, or YouTube, we're not going to be monitoring those questions on the platforms live, but if you have any questions, feel free to contact our team afterwards. So today we'll be highlighting the important work done by our Custody Health Services Department. Whether you're exploring a new career path or simply interested in learning more about the department, we hope that today's session provides you with a greater insight into the medical assistant's role in correctional health and the meaningful work our employees do in this unique healthcare setting. For today's session, we'll be providing an overview of Custody Health Services, where medical assistants are staffed within the department, what the team environment and day-to-day role looks like, and training and career growth opportunities that are available for medical assistants here. We'll also leave some time at the end for questions and answers. So before we get started, I wanted to let you know that we do have a job posting open right now for medical assistant positions in this department. To find it, you can scan the QR code located behind me on the screen right now, or go to sccjobs.org and search for medical assistant in our list of current opportunities. One note, this job posting is for a temporary position. This is what the county calls extra help. But there will be opportunities for advancement and permanent positions available in the future. So we encourage you, if you're at all interested, to apply right away to this position. So with that said, let's get started. I'm very pleased to introduce our guest speaker for this session today, Denise Moore. Hi, Denise. Thanks for joining us today.
Thank you.
It's an honor to have you here with us, and I'm excited to learn more about your perspective on working for this department. So can you please introduce yourself and, for a minute or two, share your role in Custody Health Services?
Absolutely. So good afternoon, everyone. I am Denise Moore, and I am the Executive Nursing Director. I have been in custody health just a little over a year, came from the acute care background, and I will say this to you. I wish I would have known about this many years earlier because I'm extremely excited. And I'm going to tell you why. We are healthcare providers here. We do have 4 jails here. The first one is Main Jail, which is centrally located. They house at least 700 inmates. Mm-hmm. The other 2 are juveniles. They house between 80 to 100 juveniles. Mm-hmm. And the larger one is Elmwood campus. And that campus houses on an average of 1,700 inmates. The people who provide care, healthcare, are physicians. We have nurse practitioners. We have psychiatrists, registered nurses, LVNs, MAs, HSAs, and unit medical clerks. We do house male and female, of which they are separated on the campuses. The opportunity we have here in Custody Health is we're providing health care to those vulnerable patients, many of which have not received it external outside of jail. So that's why we are here to provide that care to them. Mm-hmm. We are a little different from the hospital setting in that we have to have a deputy, your custody bureau by our side when we provide health care to the patients. Mm-hmm. It's just for a safety precaution. We do not provide any emergency care other than stabilizing the patients and transferring them out. And the other thing is, too, we only provide CPR. We do not provide advanced life support systems here. So that's what separates us, and that's an overview of healthcare here in the custody.
Awesome. Well, thank you for sharing that. So there are a diversity of career opportunities for anyone interested in healthcare and also behavioral health. This is one webinar in a series that our department is doing over the next couple of months. So do watch for the recordings of the past events we did to learn more about specific opportunities and more about this department. And we'll be sharing more about that. But next, I wanted to dive a little bit deeper into the medical assistant role. So can you walk us through what a typical day or shift looks like for a medical assistant here in custody health?
Absolutely. Medical assistants are a very important role in our day-to-day operations. They primarily work with the providers. Mostly on a day shift. We do have some working on the PM, which is 3 to 11 shifts. They have an integral role in they prepare the room for the providers to get ready for their patients. They make sure that things are cleaned and ready for that patient to come in. Once the patient is ready to come in, they will escort the patient in. And it's like the medical assistants outside of a jail. You do the normal procedures with your care, meaning you're going to bring the patient in, get them ready for their visit. You're also going to take vital signs on the patient. And if indeed there are any abnormal vital signs, certainly, as you know, you will communicate those to the provider at that time. Also making sure that we are getting the patient in a position where that once they speak with their providers for their care, and then they are ready to complete their services, we want to make sure that they have any education provided to them once the clinic is over for that individual. Once that happens, and then the medical assistant will, once the patient leaves, they will make sure that the room is restocked with the necessary supplies and equipment. They will make sure that the room is cleaned by wiping down, the tables and all other surfaces. They will also ensure that the patients get their after visit educational materials before they leave. And then one of the important thing is they will also be involved in rescheduling follow-up clinic appointments. So it's a very important position because the providers really rely on the medical assistants to get each clinic visit complete and done timely.
Okay. Yeah, it sounds like they play a really important role in streamlining the process and keeping things moving efficiently in the department and helping making sure that the patient's needs are met. Wonderful. So I think you touched on this. So, like, what are the duties and patient care needs that medical assistants generally handle? Can you share a little bit more about the patient concerns, maybe that for folks that aren't familiar with custody health services, what kinds of medical conditions and things are these medical assistants going to be assisting with?
Absolutely. We provide OB services. So if you have a patient that has OB needs, we will help that provider. We provide psychiatric care, and we do in-person as well as video telemedicine with the psychiatrist. So the medical assistant involvement in that role is to help get the video set up for the patients to come in to speak with their psychiatrist.
Okay.
And the other thing is if they have to clean up or address wounds on it, medical assistant will make sure that the provider have the necessary equipment and supplies to do that. If they have ADA, requirements such as need a cane, need walkers, need a splint to their arms, they will have an integral part with that, ensuring that we do have the supplies in the room to provide the patient during their visit. The provider will provide that education, and the medical assistant will reinforce what that ADA device is used for. The other important thing, as we all know, that is the duty of a medical assistant, as like any other healthcare individual. Once we provide care, we must do clear and complete documentation in the medical record. That is so important because that will support you to communicate the steps that you have taken in this patient's visit. And so they are one that communicate clearly with providers. And also they do work with the nursing staff as well, because the nursing staff will be there for the medical assistant if they need to consult with them on anything that they may need some additional support with.
Okay.
So they are a huge supporter to our providers and our nursing staff in our clinics.
Okay, wonderful. Well, it sounds like they're really integral member of the team that's providing healthcare and behavioral health services to these patients. So that's cool. We may have some folks watching right now who are new to this career path or just getting out of their medical assistant program or considering doing such a program. So I wanted to discuss a little bit about what support looks like for new medical assistants when they start. Can you share a little bit about training opportunities and how does this work for someone just coming into this role?
Absolutely. So what we do is when we hire someone, whether you have experience or you are new to your job, we want to make sure that we will provide adequate and thorough training. What does that
Hmm.
mean? We will assign you to a preceptor, and you maybe one or two because you want to get two different aspects of different people's roles and what they do in their jobs.
Okay.
And so that orientation consists of between general hospital orientation as
Hmm.
well as in the department orientation. So in the department orientation, we do have a checklist that we use to ensure that we capture all tasks that the MAs need to do and making sure that we have validated that
Hmm.
they are competent at doing it. So they will work closely hand in hand with that preceptor to orient them between 2 weeks to 4 weeks of orientation. Now, we know people learn at different stages in life, right? So if a person needs an additional week, with the orientation, we will provide that to them because we want to make sure once they're finished with their training, they feel very comfortable with working independent of themselves. And so with that training, we also have leaders, nursing leaders that are also following up throughout that orientation to make sure that everything is on point. And if there's some things that we noticed that has not been covered, but yet it's required, we make sure that medical assistant is oriented to that part. So we're here, the leaders are here 24/7. The managers, the nurse managers, as well as myself, we carry our phones 24/7. So we're at your beck and call if you need us, our assistant. We go by the chain of command system to provide you with the necessary support you need to get you through each day. So we welcome new people, and we're very committed to making sure that you get the orientation and the training that you need to be successful here.
Wonderful. Yeah, it sounds like a really supportive work environment and a great place to begin your career in this profession. So, um, on a related note, for folks that don't currently have that are considering being a medical assistant, can you tell me a little bit about what that career path looks like? What's the training and certification required to become a medical assistant here in California?
So for that, there are multiple programs out there, and
Hmm.
it's between 9 to 17 month training,
Hmm.
depending on the program you want to attend. Some of the programs allow you to go to the training without certification, and that's okay. Other
Okay.
programs allow you to go through the training and they offer certifications, and that's okay too. Once they get in here to the system, whatever program they go to, they're past whatever training test that they have to pass, they too will be put through the rigorous orientation phase as well.
Hmm.
So we're here, we do entertain people with experience as well as those
Hmm.
without as we're going through our hiring process. And that lets us know which direction or how deep we need to go into our orientation process once they're hired and on board.
Okay, cool. Great. Thanks for sharing a little bit more about that. And if anyone has any questions about the qualifications required for this position, feel free to reach out to our team after this event and yeah, we'll help you out. But yeah, before we move on to the next question, I wanted to pause for a quick note for any viewers who just joined this webinar. Welcome. We're recording this event right now, so you can always go back and watch it again from the beginning to see what you missed. We'll be sharing it on LinkedIn, Facebook, and YouTube. So watch for that. But yes, next, for someone who's never worked in correctional health before, what qualities or skills would you say make someone successful as a medical assistant in this unique setting?
Well, I would say with that example, you would typically bring back the skills that you've done in a non-jail setting, correctional
Hmm.
setting. For an example, we're looking for people who are unbiased and open-minded,
Hmm.
people who are willing to provide care to the vulnerable population,
Hmm.
those who are willing to communicate, to get what they need, and to provide the services to our patients.
Hmm.
Understand that we are a little different because we cannot provide care without custody support, but
Hmm.
making sure that they understand that they do need the support of custody. And speaking to you, whether you're a medical assistant or a different role, I come from acute care hospital, and I will say this, I have felt extremely comfortable here, than I felt in my other careers. So oftentimes when I interviewed medical assistants, they'll ask about safety, and I will say
Hmm.
to them, we feel very safe here, because of the process we have in working with our custody partners out there. So look us up. We're here for you. We're looking for you guys to come and be added to our team. So just, follow through with the links, and we want to go from that angle.
Oh, wonderful. That's something I'll reiterate. This is something I've heard from lots of other people in this department, that this feels like the safest work environment that healthcare and behavioral health practitioners are working in because of all of the custody support. So you're very well protected, and everyone is watching out for each other as a team in this environment. Are there any specialized skills you're looking for in this position, Denise, for the medical assistants coming in?
With the skills that are required through their training,
Okay.
and those with education, certainly, making sure we understand how to work with the providers with getting the patients for their set for their appointment, making sure we understand the basics of getting the room set up for the appointments, understanding their roles when there are abnormal labs or anything that the patient may have shared with them, so that the medical assistants would go to the provider and educate them and alert them of what's going on while the patient is there. So we're looking for someone that who can communicate well, who understand that providing care to a patient is a team approach. And it takes multiple people to give support to one patient. So the general basics outside of the medical assistant training, that we do require. And also there are, if indeed someone is, shy in one area, lacking in another area, we're here to support them as well.
Okay, wonderful. Well, that's great. Um, let's see. What career growth opportunities are available for medical assistants within custody health, both within the department as well as the broader county of Santa Clara? Can you talk a little bit about what medical assistants could look forward to as they move
Sure.
forward in their career?
Sure. Sometimes medical assistants, we have, because we are affiliated with the hospitals,
Hmm.
sometimes they may want to get another opportunity or area to work in, and they are able to transfer there. Other opportunities, we do support educational opportunities. If sometimes, and we've had some that have expressed they want to go back to school for another title or responsible individual. We do work with them and work with their schedules to make sure that they're
Hmm.
getting the training they want to. So we're very flexible to try to take care of our employees to make sure that they are growing in their professional lives. And in any other educational classes that they see, we're very open to that as well, to allow them to
Hmm.
arrange their schedules so that they can attend training and educations.
Okay, great. Are there particular positions that a medical assistant would advance into typically?
Generally, if for medical assistance, you pretty much stay in that position. However,
Hmm.
you can work in other areas of,
Hmm.
of the facility. You can work in other areas. You can work with the providers. Now we're having medical assistants to work with the nurses. If they say, okay, well, I've worked in custody for a while, I would like to get back into the hospital setting. They can do that. And then once you get into the hospital setting, because
Yeah.
you're internal, you can work in different areas of the hospital. So we
Hmm.
do we do have that opportunity for them to choose from.
Cool. So on that note, that goes back to your personal history. You started in acute care in our hospitals. What is something you wish you knew about working for this department before you started here?
I'm glad you asked that question. I wish I knew what I know now about it. I would have been here earlier, sooner, because oftentimes when you say, "Oh, working in correctional healthcare," it's a little scary, but actually, it's not. It is not
Mhm.
scary, and I will say to you honestly, it is the safest place I've worked as a healthcare provider. Because we have our excellent custody partners there
Mhm.
with us. So
Yeah.
just to relieve people of that thought, it is very safe. We are very supportive of each other, and the team truly works together as a unit to provide health care to our patients. And that's what they are to us. They are our patients.
Wonderful. Is there anything you can share about why you feel like this is rewarding work? Um,
Well, for me, historically, I've enjoyed working with the underserved population or the vulnerable
yeah.
population. And I think we want and need people who feel that way as well. We're here to provide excellent care for our patients. We're here to ensure that our patients are safe. And we want people who are committed to help assist us with providing this care. Because, as mentioned earlier, some of our patients have not received medical care
Yeah.
until they come in here. So that brings joy to us that we can help nurse them back to good health.
Yeah.
That is a reward for us and myself specifically. And I hear that from many of our MAs, nurses, LVNs. So that is a reward there, just trying to help provide good health care to the vulnerable population. And that we do.
Wonderful. Yeah, that's something I've heard from other providers in your department, other staff members. This is so rewarding to be able to be, the first person that's provided healthcare and a smiling face to these people that are really
Yes,
underlooked. So
yes.
overlooked. So great. And before we wrap up, do you have any final messages you'd like to share with our viewers who might be considering a career as a medical assistant here at Custody Health?
Absolutely. I think if you want a job where you will feel extreme satisfaction, we're the place you should come. And I say that to you sincerely because I just enjoy working here because it affords us opportunity to do what we do best is provide good health care. And in an environment that it has a lot of good rewards, because the one thing for me and my
Mhm.
other colleagues and the staff is when you're able to make someone who doesn't feel well needing a doctor's appointment come out and be treated and then feel well, that's a blessing. So we are currently interviewing for medical assistants. We want those out there who want to join us, and we will welcome you with open arms. So please do apply.
Excellent. Well, thank you so much for that, Denise. We really appreciate you sharing all of your expertise and your wisdom about this department and encouraging people to apply. So,
Yes.
with that said, thank you so much for your time. I wanted to take just a couple minutes right now to wrap us up by talking about how you can apply because we want folks watching here to apply for this position. So, last, I wanted to share a few quick application tips for how to apply for our medical assistant opportunity. So to apply, you can scan the QR code behind me or up on the screen right now to view our job openings, or go to www.sccjobs.org to check out all of our job postings listed under the open competitive opportunities. Look for the position listed as medical assistant, custody health services, extra help. I'll ask someone from my team to include the direct link to that in the chat if they can. And finally, I want to do a quick overview of the county's hiring process. First, you're going to submit an official job application online. I'm using that link that we're sharing. Our recruitments are typically posted for about 2 weeks, though sometimes we extend them. And when you do see a recruitment, we encourage you to apply as soon as possible because it may not be open that long. The application review process begins once the job posting closes. So wait for that close date before you will generally hear from one of our team members about the next steps. Your application will be ranked based on overall qualifications. And then once the application review process is concluded, applicants will receive an email notification within a couple weeks from the date the job posting closed, depending on how many applications are received for that recruitment. So a couple of important tips. The county reviews every single application. Therefore, it's important to complete every section, especially the work history, and be sure to attach your certifications. You're going to want to be sure to answer the supplemental questions carefully and completely. Those are something that sometimes applicants overlook those questions, but it's really important that we have thorough responses to that question section at the end of your application so we can confirm you're qualified for this position and understand your experience fully. After you apply, continue to check your email regularly. I would encourage you to check your email every day for updates regarding your application, including checking your spam or junk folder, as sometimes, unfortunately, important messages may wind up there. But if you have any other questions about the county's hiring process or this opportunity, feel free to reach out to us. One of my teammates can drop our email in the chat. It is DEIsourcing@esa.sccgov.org. If you have any questions for me or Denise, our speaker, please send them to that email address, and we'll have someone get back to you as soon as possible. So thank you everyone for joining us today. We really appreciate your time and interest in the medical assistant opportunities within Custody Health Services. We hope that this session has given you a better understanding of this role and what it's like to work in this unique and incredibly rewarding setting. So if you're considering a career with Custody Health, know you'll be joining a team committed to providing compassionate care to a very underserved patient population, as Denise explained, supporting one another in this unique setting and making a meaningful difference in the lives of those we serve. So we would love to have you apply, and we hope to have you join us. So finally, I wanted to thank our guest, Denise, for joining me today. Your valuable insights into the medical assistant role, the work of Custody Health Services, and your experience working for the county have truly brought this session to life. So I'm so grateful for your time.
Thank you. It was a pleasure.
Thanks, Denise.
Thank you.
And thank you to everyone who tuned in today. We hope to see you at the next session of our Custody Health Careers webinar series. This is going to be happening sometime in July. We haven't confirmed the date yet, but we'll be doing a department overview, sharing the day-to-day experience of working for Custody Health, and some other information that is crucial for anyone considering a career role here at Custody Health. So watch for more information about that event coming up on our social media platforms and email. So thank you all for your time today. I appreciate you joining us.